Welcome back. Access to quality health care is a basic human right, yet so many struggle to access the care they need due to, various barriers such as cost, geographical access and time constraints. Unu Health is revolutionizing the landscape with the launch of a new app that makes private healthcare accessible and affordable for all. The digital healthcare provider is taking on this challenge with its innovative app that puts healthcare at users' fingertips. To tell us more about the app, the CEO and principal at Unu Health, Tania Joffe, joins us now in studio. Tania, very good morning. Thanks for joining us. Welcome.
Thanks so much for having me, Superior.
Let's talk about what inspired you to start Unu Health and just take us through how this app works.
I'd love to. So maybe a little bit of background and a little bit of my personal story as well. So I've spent about 25 years in the corporate world, in the private sector, largely on the front line in customer service. I have a passion for service. Actually, I got my way through varsity by waitressing, which if you don't serve, you don't get, happy customers, no smiles. So through that process, ended up in the front line, set up a large call centre, actually just down the road here, biggest call centre in the Southern Hemisphere, and we won lots of service awards. I then found myself in insurance innovation with Standard Bank Group. And when we looked at the different verticals from an innovation perspective, what really struck us was healthcare really stood out compared to even education mobility in terms of a couple of things. Life expectancy on our continent is 10 years below that of the global average. We are really under-resourced from a healthcare perspective. We consume about 3% of the world's health resources, but we carry 24% of the global disease burden. So that really stood out. And the bank, with its vision to drive Africa is my home, I drive her growth, healthcare is a key vertical that underpins that. So we decided we need to do something as a sub-Saharan player, and that is how Unu Health, as a venture within Standard Bank, was funded and founded about 3 years ago, to really transform access to quality healthcare. Because it shouldn't.
What is that gap that you are trying to cover? I mean, what is that spark that led to the creation of this app? And I'm going to ask you to move your hair from the mic because it's blocking the mic. Thank you.
Apologies.
Thank you. Thank you.
So the gap that we're trying to support is one of a healthcare system that is overwhelmed. So if you look at healthcare on our continent in South Africa, 85% of people in our country are reliant on the public healthcare system. So if, for example, you're not feeling well today, you would need to, the clinics are closed. It would be very difficult to get to a GP. You'd probably pop into a pharmacy and self-medicate or ignore your symptoms. But now with the app, you can hop onto our app. You can speak to a doctor within 5 minutes for 179 Rand, get your script, get the support you need, and access quality care, affordable quality care. Right.
So what's your vision for Unu Health? I mean, what is it? What are some of the key factors that you're going to incorporate in terms of making this even more accessible and expand this project?
So as a vision, we want to have everybody be able to access quality health care. It's a human right, and everybody should have equal access, and it should not be a function of what you earn. So many people cannot afford private medical aid, it's just too expensive. Accessing private healthcare is very expensive, so we rely on state, and while state is doing the best it can, and there are amazing people working in that space, it's overwhelmed. I mean, I drive from 4 ways to work every morning, past the Witkoppen clinic, and people are queuing from 4:30 in the morning, and if they're lucky enough, they are early enough to see somebody that day. But many are told, sorry, we can't see you today. So that's what we're trying to address. And you can with technology. The same way that you do your banking on your phone, we're saying do healthcare from your phone. So both screening, the technology is incredible. There's more innovation happening in the healthcare vertical than any other vertical. So you can, for example, on our app, do a 50-second face screen. Right now, you can download it, do a 50-second face screen and get your blood pressure.
Really?
And your pulse, and your oxygen levels, and soon, your glucose levels.
Has the accuracy been proven?
Yes. It's amazing. So what it does is it takes a picture, it's optical, so it's through your smartphone. It takes a picture of the blood flow just below your skin surface, and it's actually picking up the pulse, the volumetric change, and based on that, it can give you the blood pressure and your pulse. What it will now also do is do your glucose level. It's not fully trained, so it's using the optical signal, it's using AI, and algorithms, and it's clinically accurate. And like in your viewership this morning, 1 in 3 adults have elevated blood pressure, and they don't know it. So what we want to do is we want to give you through your phone free access to do, and you can do it right away. That's why I was checking whether
Okay.
you've been on our app to see whether you have elevated blood pressure, because you're asymptomatic for so long. These lifestyle diseases, like diabetes is the #1 reason women die in South Africa. You don't feel diabetes until it's almost too late. You know, when you start getting that tingling in your hands, the blurred vision, the disease has progressed probably over 15 years, maybe even 2 decades. And there's no reason to go and check your glucose if you're feeling well, especially if there's so much friction in doing it. Taking a day's leave, going to a clinic, finding a GP. I mean, you don't do that.
Yeah.
So we want to make it as easy as your smartphone.
So what's the level of collaboration between you and, between yourselves and, of course, the state in terms of, finding common ground in getting access to healthcare more affordable to everybody?
We'd love it to be enormous, so we absolutely believe that you need partnerships. It's such a big challenge to capacitate healthcare. We think leveraging technology is going to be a key enabler because it drives costs down, it drives access up. But beyond that, also we don't have enough. I think we have such a shortage of nurses, and yet we have so many nurses and doctors that are unemployed. So there's also a funding issue. So we believe absolutely partnership is the way to go. If we can partner with state, if we can partner with private enterprises. So for example, on our app, Intercare is providing the doctor service, the Intercare group. So we partner widely. The technology is a partnership. The AI triage is a partnership. So we absolutely believe in partnership.
Awesome stuff. So how do you download the app?
You literally go to the App Store, Google Play, App Gallery, download the app, create a profile, do your face scan, check your blood pressure, and then if you need to see a doctor today on a Sunday, you can do that for 179 Rand.
This is so cool, and the fact that it's user-friendly, anybody can use it.
That's our whole, so can I tell a quick story? So coming out of insurance innovation and the insurance component, if you have an accident in your car, God forbid, and you take it to a garage, they'll give you a quote, they'll tell you what's wrong with your car, they'll give you a guarantee and they'll fix it, and if it's not working exactly as you expect afterwards, you have recourse. Now if you think about healthcare, so the human body is obviously much more complex. It is an absolute engineering marvel.
Yeah.
But yet, if you're not well, it's really difficult to navigate your route to actually finding the right care at the right time that is affordable. And that's what we want to do. We want to empower people to own their well-being journeys. Know your numbers, like your blood pressure, your pulse, hopefully your glucose, and then have access to professionals that can actually help you.
Awesome stuff. Tania, great chatting to you. This is a brilliant innovation. Thank you so much for joining us.
Thank you for having us.
Great stuff. Well, that was the CEO and principal at Unu Health, Tania Joffe, talking to us about the launch of a new app called Unu Health App, which makes private healthcare accessible and affordable for all.